Operation Sea Spray. In September 1950, a U.S. Navy minesweeper quietly navigated the fog-laden waters just outside the Golden Gate Bridge. Its crew, following classified orders, released a fine aerosol mist into the coastal wind. The target was not an enemy. It was San Francisco. Over 6 consecutive days, the vessel made repeated passes, dispersing what internal documents later described as a simulated biological attack over one of America's most densely populated cities. Nobody on the ground was warned. Nobody consented. The aerosol contained Serratia marcescens, a bacteria the military had classified as harmless for testing purposes, and Bacillus globigii, a spore-forming organism used as a stand-in for anthrax. Within weeks, 11 patients at Stanford University Hospital were admitted with a rare Serratia infection. 1 died. Edward Nevin, a 75-year-old recovering from a urological procedure, became the first confirmed casualty of a domestic biological weapons test conducted on American soil. His family later sued the government and lost. The case was sealed under national security provisions. Declassified records obtained through Freedom of Information requests in the 1970s confirmed that the Navy conducted at least 239 open-air biological tests over American cities between 1949 and 1969. San Francisco was simply the first documented case. Scientists at the Battelle Memorial Institute, who reviewed the targeting methodology, noted that the dispersal patterns had been optimized for maximum urban penetration, not minimal civilian exposure. That distinction matters. Following the FOIA disclosure, a Senate subcommittee launched a preliminary inquiry. 3 of the principal researchers named in the original project files had already retired. 1 had died. The relevant operational logs from the Pacific Fleet's Biological Testing Division were listed as transferred to a federal storage facility in 1972. When investigators requested access, they were informed the records had been destroyed during a routine archival purge. No supervisor was identified as responsible for authorizing that purge. If the bacteria were truly harmless, why were residents never informed even decades later? Why did the dispersal coordinates prioritize residential neighborhoods over industrial zones? And why, when the Senate inquiry came within reach of the operational chain of command, did the paper trail end at a destroyed archive? Edward Nevin's grandson still carries the death certificate. Somewhere, in a federal basement, the targeting maps may still exist. Or they may not. That uncertainty is the point. Project SHAD. In the summer of 1964, aboard the USS George Eastman, stationed in the remote waters of the Pacific Ocean, a group of American sailors were ordered to remain on deck during what their commanding officers described as a routine readiness drill. The ship was then sprayed with an aerosolized agent from a low-flying aircraft. The sailors were not issued protective equipment. They were not informed of the substance. They were observed. Project SHAD, which stood for Shipboard Hazard and Defense, was a classified Pentagon program running from 1962 to 1974. Designed to assess the vulnerability of U.S. warships to chemical and biological attack. Across 46 separate tests conducted in locations ranging from the Pacific to the Caribbean, thousands of active-duty military personnel were exposed to agents including VX nerve agent, sarin, and various biological simulants. Internal documents describe the human subjects as providing invaluable exposure data. The men themselves were given no such description of their role. Veterans who survived SHAD began reporting clusters of neurological disorders, autoimmune diseases, and rare cancers through the 1980s and 1990s. When they filed for VA disability benefits, they were told their service records showed no unusual exposures. That was technically accurate. The exposures had never been entered into official service records. The Pentagon did not acknowledge the program's existence until 2000, when a General Accounting Office investigation confirmed that records for at least 12 of the 46 tests had been either lost or destroyed. In 2002, Congress mandated that the Department of Defense notify all surviving SHAD participants of their potential exposure. The notification process was contracted to a private health firm. Of the estimated 6,000 veterans believed to have participated, fewer than half were successfully contacted before the outreach program was quietly defunded in 2006. The health study commissioned to track long-term outcomes was terminated before its scheduled completion. Its preliminary findings were never released. These men were deployed to defend their country. Instead, they were used to measure how efficiently nerve agents penetrate human skin at sea level. How many are still waiting for a letter that will never arrive? How many filed their symptoms under unknown causes because no doctor could access records that officially did not exist? The ocean keeps no records. Neither, it seems, does the Pentagon. The Guatemalan syphilis trials. In October 1946, Dr. John Cutler, a young U.S. Public Health Service physician, arrived in Guatemala City carrying sealed canisters of live syphilis bacteria and letters of cooperation signed by Guatemalan health officials. His mission, funded by the National Institutes of Health and operating under the direct knowledge of Surgeon General Thomas Perrin, was to deliberately infect human subjects with sexually transmitted diseases to test the efficacy of penicillin. The subjects were selected for their inability to refuse. They were prisoners, psychiatric patients, and soldiers. Over the following 2 years, Cutler and his team infected approximately 1,300 Guatemalan citizens with syphilis, gonorrhea, and chancroid. The methodology included paying female sex workers who had been deliberately infected to have intercourse with male prisoners, directly inoculating subjects by abrading skin and applying bacterial cultures, and injecting gonorrhea directly into the eyes of psychiatric patients. When some subjects failed to contract the disease after standard exposure, the team escalated the methods. Internal correspondence between Cutler and his NIH supervisors, recovered by historian Susan Reverby in 2010, discussed the escalation without ethical objection. At least 83 subjects died during or following the experiment period, though the causal links were never formally established because no follow-up care protocol was ever implemented. Cutler returned to the United States and went on to lead the Tuskegee Syphilis Study, another government-funded experiment that denied treatment to Black American men already infected with syphilis. The Guatemala work remained classified and entirely unknown until Reverby's archival discovery 64 years later. When the Guatemalan trials were disclosed in 2010, President Obama called the Guatemalan president to apologize. A presidential commission for the study of bioethical issues was convened and issued a report. That report recommended compensation for victims and surviving families. As of the time of writing, no compensation has been paid. A class action lawsuit filed in U.S. federal court was dismissed in 2012 on the grounds that foreign citizens cannot sue the U.S. government for acts committed on foreign soil. Cutler knew he could not conduct these experiments on American soil. That is precisely why he went to Guatemala. So, when the legal system confirms that what was illegal at home carries no consequences abroad, what exactly was the ethical principle being protected? And if the Guatemala files remain sealed for 64 years, how many similar programs from the same era remain sealed still? Project MKUltra. On the morning of November 28, 1953, Frank Olson, a senior U.S. Army biochemist working under CIA contract, fell from the window of room 1018A at the Statler Hotel in New York City. He was found on the pavement 10 floors below. The death was ruled a suicide. 9 days earlier, Olson had been covertly dosed with LSD without his knowledge during a CIA retreat in rural Maryland. He had reportedly expressed a desire to leave the program. He was dead within 2 weeks. MKUltra was a covert CIA program launched in 1953 under Director Allen Dulles, with a formal objective of developing techniques for mind control, interrogation enhancement, and behavioral modification. Across 150 separate sub-projects conducted at 80 institutions, including Harvard, Stanford, and Columbia, the program administered LSD, barbiturates, mescaline, and electroconvulsive therapy to subjects that included mental patients, prisoners, drug addicts, and foreign nationals, often without consent. A sub-program called Operation Midnight Climax established CIA-run safe houses in San Francisco and New York, where agents hired sex workers to lure men off the street, drug them with LSD, and observe their behavior through one-way mirrors. The program was ordered destroyed in 1973 by CIA Director Richard Helms, who authorized the shredding of all MKUltra files before a congressional inquiry could access them. Approximately 20,000 documents survived only because they had been misfiled in a financial records building not included in the destruction order. Those documents, discovered during a 1977 FOIA request, formed the basis of the Senate Church Committee hearings. The committee found evidence of at least 2 domestic deaths directly attributable to the program. Helms was never charged. Frank Olson's body was exhumed in 1994 at the request of his family. A forensic examination conducted by James Starrs, professor of forensic science at George Washington University, found evidence of blunt force trauma to the head inconsistent with a fall. The New York District Attorney opened a homicide investigation. It was closed in 1996 without charges, citing insufficient evidence. The CIA has never commented on the forensic findings. The surviving documents represent a fraction of what existed. If 20,000 pages survived by accident, how many hundreds of thousands were successfully destroyed? And if the program's architects faced no legal consequence after public exposure, what deterrent existed against simply beginning again under a different name and a cleaner filing system? The Tuskegee Study. On July 25, 1972, Associated Press reporter Jean Heller published a story that should have been impossible. She had obtained internal U.S. Public Health Service documents confirming that for the previous 40 years, the federal government had been deliberately withholding treatment from 399 black men in Macon County, Alabama, who had been enrolled in a study of untreated syphilis. The men had not been told they had syphilis. They had been told they were receiving treatment for bad blood. The treatment was a placebo. The study's actual purpose was to observe how syphilis destroyed the human body from infection to autopsy. The Tuskegee Syphilis Study began in 1932, framed as a 6-month observational project. It ran for 40 years. Even after penicillin became the standard, widely available cure for syphilis in 1947, the men were not treated. Worse, in 1943, when the U.S. military began drafting men from Macon County, Public Health Service officials contacted the draft board directly to ensure that study participants were not given the standard military syphilis treatment that would have cured them and ended the study. Letters obtained from the National Archives show that this intervention was discussed in routine internal correspondence, with no indication of ethical concern. By the time the study was terminated following Heller's article, 28 men had died directly of syphilis. 100 had died of related complications. 40 wives had been infected, and 19 children had been born with congenital syphilis. Dr. John Heller, who directed the program during its middle decades, stated in a 1976 interview that the men's status did not warrant ethical debate because they were subjects, not patients. That framing, subject rather than patient, had been the operational standard since 1932. A federal investigation launched immediately after the story broke led to the termination of the study and, eventually, to the National Research Act of 1974, which established institutional review boards for human subject research. It did not lead to criminal prosecution. Not one physician, administrator, or official involved in the study faced legal consequences. A formal presidential apology was delivered by Bill Clinton in 1997, 65 years after the study began. The men of Macon County trusted a system that had decided their deaths were more useful than their lives. That decision was made in meetings, written in memos, and reviewed annually for 4 decades without a single internal objection reaching public record. How many review meetings were held? How many signatures were collected? And how many people drove home that evening, had dinner, and never mentioned it? The Edgewood Arsenal Experiments. Between 1955 and 1975, at a secure facility in Edgewood, Maryland, the U.S. Army Chemical Corps enrolled approximately 7,000 active-duty American soldiers in a classified research program. The soldiers were told they were testing new military uniforms and equipment. Some were. The majority were administered chemical agents, including nerve agents, psychochemicals, and experimental pharmaceutical compounds under medical supervision that was designed to observe effects, not prevent them. Informed consent forms, where they existed, obscured the nature of the substances being tested. The program's pharmaceutical arm tested over 250 different compounds, including BZ, a potent incapacitating agent that induces severe hallucinations and delirium, the anticholinergic drug EA3167, and various combinations of sedatives and stimulants designed to produce controllable states of cognitive impairment. Researchers from the Army, the CIA, and several academic institutions collaborated on the protocol design. A 1975 review conducted by the Army Surgeon General's office found that in many cases the doses administered exceeded safe clinical thresholds. The review was classified. Veterans from the program began reporting long-term neurological effects through the 1980s. Memory degradation, chronic anxiety disorders, and unexplained tremors appeared across the cohort in statistically significant clusters. When veterans applied for disability compensation, the VA initially denied most claims on the basis that the experiments had been fully supervised and therefore carried no liability. A 1994 GAO report found that the Army had lost or destroyed the medical records of at least 1,000 Edgewood participants. Without records, no causal link could be formally established. Without a causal link, no compensation could be awarded. In 2009, a federal class action lawsuit filed on behalf of Vietnam Veterans of America demanded that the Army provide ongoing medical monitoring for all surviving Edgewood participants. A federal judge ruled in favor of the plaintiffs. The Army appealed. During the appeals process, the monitoring program was suspended. The appeal was decided in 2015. By that point, several of the lead plaintiffs had died. The Army expressed no public position on the timing. 7,000 soldiers, 20 years, 250 compounds, and the central question that no court has ever formally answered. At what point does a soldier's enlistment contract authorize the military to use their neurological system as a data collection instrument? Operation Whitecoat. In the spring of 1955, a group of Seventh-day Adventist men arrived at Fort Detrick in Frederick, Maryland, under a quiet arrangement between the U.S. Army and the church's leadership. These men were conscientious objectors who had agreed, as an alternative to combat service, to serve as voluntary subjects in biological warfare defense research. They were told the experiments would be defensive in nature, and that their faith-based refusal to bear arms would be honored through scientific service. What they were not told was how that service would be defined by the men running the program. Operation Whitecoat ran from 1954 to 1973 and enrolled approximately 2,300 Adventist volunteers who were exposed to biological agents, including Q fever, tularemia, sandfly fever, typhoid, and viral hemorrhagic fever. The program's stated purpose was to develop vaccines and treatments for these agents. Its actual utility, as confirmed by declassified Army research summaries, was to establish precise human dosage thresholds, the exact concentrations needed to incapacitate a soldier, data that had no defensive application and served exclusively as offensive weapons calibration. Several former participants who came forward in the 1990s described being given no information about the specific agent they were receiving or the expected physiological timeline. Medical staff monitored progression of illness, but in multiple documented cases, withheld treatment beyond what was necessary to observe peak symptom development. Subjects who asked what they had been given were told the information was classified. Some were hospitalized for weeks. The Army classified all individual case records under national security provisions. Fort Detrick's Office of Medical History completed an internal retrospective of Operation Whitecoat in 1998. It was labeled for internal distribution only. A heavily redacted version was released under FOIA in 2006. The sections describing dosage calibration methodology and the full list of agents used in Phase 3 trials remain classified. Requests to declassify those sections have been denied on grounds of ongoing relevance to national defense. These men believed they were serving God and country without taking a life. Whether the Army shared that understanding depends on which documents you are allowed to read. Before MKUltra, there was this. In the winter of 1951, at a classified CIA facility whose location remains redacted in all surviving documentation, a man identified only as Subject 143 was administered a combination of sodium pentothal and an unidentified hypnotic compound over a period of 4 consecutive days. The sessions were recorded on magnetic tape. The tapes have never been released. What survives is a single internal memorandum, recovered in the 1977 document trove, describing the subject as having demonstrated remarkable receptivity to post-hypnotic instruction following chemical induction. Whether subject 143 consented, survived, or was ever identified remains unknown. Project Artichoke was the CIA's behavioral control program that preceded and directly seeded MKUltra. Launched in 1951 under the Office of Scientific Intelligence, it investigated whether the agency could produce what internal documents called an operative who could carry out an assassination without conscious awareness of doing so, then develop a genuine amnesia for the act. Research methods included prolonged sensory deprivation, electroconvulsive therapy delivered without anesthetic, and combined pharmacological regimens designed to create, reinforce, and then selectively erase memories. The program was conducted not only at domestic facilities, but also at CIA stations in West Germany and Japan, where post-war legal ambiguity made subject acquisition considerably easier. Former members of the Soviet intelligence apparatus and North Korean prisoners of war were among those documented as subjects in overseas sessions. A 1952 internal review found that several overseas subjects had suffered permanent psychological damage. The review recommended more precise dosage calibration. It did not recommend stopping. Project Artichoke was officially rolled into MKUltra in 1953. Several of its research directors continued in their roles without interruption. When the 1977 Senate hearings focused almost entirely on MKUltra, Artichoke received fewer than 4 pages of testimony. The overseas files were described by the CIA's representative as incomplete due to transmission loss during the transition of programs. No foreign government was ever notified that its citizens had been used as research subjects. Subject 143 appears in only that one document. No other record bearing that designation has ever surfaced. Either the file was destroyed, or Subject 143 was never given a file at all. The Denver Radium Experiments. In 1963, at the Colorado General Hospital in Denver, a team of researchers funded jointly by the Atomic Energy Commission and the U.S. Public Health Service began administering radioactive iodine doses to a group of children between the ages of 7 and 14. The children had been referred for thyroid evaluation. Their parents had signed consent forms that described the procedure as a diagnostic tracer test. The forms did not specify that the isotope being used, iodine 131, was the same substance identified in subsequent decades as a primary driver of childhood thyroid cancer following nuclear fallout exposure. The study was part of a broader federal program investigating thyroid function and radiation metabolism in pediatric populations. Between 1945 and 1975, an estimated 16,000 hospital patients nationwide were administered radioisotopes under research protocols that either omitted or misrepresented the experimental nature of the procedures. The Advisory Committee on Human Radiation Experiments, convened by President Clinton in 1994, reviewed approximately 4,000 of these cases and found that meaningful informed consent had been absent in the overwhelming majority. The committee's final report, submitted in 1995, ran to 900 pages. Congress received it and took no legislative action. Former child subjects from the Denver cohort began organizing in the early 1990s after the AEC documents were partially declassified. Several reported thyroid abnormalities, nodular growths, and 2 confirmed malignancies that their physicians identified as consistent with early-stage iodine 131 exposure. When they requested their original research records from Colorado General, they were informed that patient files from that period had been transferred to a federal health archive. The archive confirmed receipt of the transfer, but could not locate the specific cohort files. The Atomic Energy Commission documents that describe the Denver Protocol in operational detail remain partially classified under a national security exemption related to nuclear materials research. The exemption was applied in 1974 and has been renewed without public review in every subsequent declassification cycle. A 2003 petition from a former subjects advocacy group requesting full declassification was denied without stated reasoning. These were children. They were given radioactive material inside a hospital room while their parents waited outside, reading forms that had been written to obscure rather than inform. At what age does a government owe its youngest citizens an honest accounting? And who decides when that debt expires? The Mosquito Releases. In the late summer of 1956, residents of Savannah, Georgia, noticed an unusual density of mosquitoes gathering near the city's residential streets. No public health advisory had been issued. No vector control operation had been announced. What the residents could not have known was that the U.S. Army Chemical Corps had, over the preceding weeks, released approximately 330,000 uninfected Aedes aegypti mosquitoes over the city from low-altitude aircraft as part of a classified experiment designated Operation Big Buzz. The objective was to determine whether mosquitoes could be used as an effective delivery system for biological agents across a populated urban environment. Aedes aegypti is the primary vector species for yellow fever, dengue, and Zika. The Army's choice of this species for urban dispersal testing was not incidental. Internal planning documents, partially declassified in 1981, confirmed that the Savannah release was preceded by laboratory studies specifically examining A. aegypti's biting frequency and geographic dispersal patterns when released at high density in warm, humid climates. Savannah was selected because its summer climate matched the target deployment conditions being modeled. The city's population was the variable being measured. Additional releases occurred in Avon Park, Florida, in 1956 and 1958, where residents reported unusual clusters of illness, including febrile illness, respiratory symptoms, and at least one unconfirmed fatality in the weeks following the dispersal operations. Army teams posing as public health workers conducted follow-up surveys in the affected neighborhoods, gathering epidemiological data directly from residents who did not know they were participants in a weapons test. The survey instruments from the Florida operations were classified at the time of collection. The Avon Park documents were obtained through FOIA requests filed by journalist H.P. Albarelli in 2006. Several pages within the operational summaries describing the illness surveillance methodology had been redacted. The Army's response to requests to declassify those sections cited exemptions under national security and ongoing defense research provisions. As of the last available FOIA response log, that exemption remains in place. The CDC, which now maintains surveillance authority over A. aegypti populations in the southeastern United States, has never referenced the 1956 and 1958 dispersal operations in any public epidemiological report. 330,000 mosquitoes over one American city, in summer, without a single posted notice. The Army measured how far they spread, how often they bit, and which neighborhoods saw the highest contact rates. Someone graphed those results, someone filed the report, and somewhere between that filing cabinet and the present day, the people of Savannah were never told they had been the experiment.